Hi, welcome to Entrepreneur Education. This short video we're doing in regards to your pre-screening and fitness appraisals as part of Certificate 3 in Fitness. Firstly, I'd like to introduce myself. My name is Duncan. I'm one of the actual mentors here delivering in Certificate 3 in Fitness. So today, I want to go over some of the key points that we need to refer to when we're looking at doing that pre-screening and also the appraisals. Oh, come in. You must be Sam?
Yes, I am.
Hi, I'm Duncan.
Nice to meet you, Duncan.
Great, welcome to eGym. We're just about to go over and do your fitness test, as you're aware of.
Yep.
Now, first thing, just before we start the test, as you would have already been informed of, is have you had anything to eat this morning?
I had a light breakfast, but yeah.
A light breakfast? That's okay, great. So now, if you'd like to have a seat for me.
Yep. Oh, thank you.
Please have a seat. Great. And now, as we say, we're going to go through and have a look at your actual assessments.
Yep.
And I'm just about to explain those. Oh, okay, Sam. So, great to see you here. What I'd like to do first is we just want to go over the actual tests we're going to do as part of your pre-screening and your fitness appraisals. All right? So, first things first, we're going to go through really quickly our adult, pre-exercise and screening, and quickly go over that. Once we've covered this, the next thing I'm going to get you to do is we're going to go through and do your blood pressure, and then we're going to take a resting heart rate. Okay? From there, we're going to go and do a couple of measurements using this tape here. As I said before, and we'll go over this a bit later, one will be at belly button or just above for that narrowest point, and the other one will be down around through your hips, and we'll cover that a bit more later. Are you okay with that?
Yeah.
Excellent, great. So let's get started. So first things first, Sam, what's your surname, please?
Burkett. So B-U-R-K-E-T-T.
B-U-R-K-E-T-T, that's correct?
Yep.
Okay. And what's your date of birth, please?
The 9th of July, 1990.
9th of 7th, 1990. Yes?
Yep.
Awesome. All right, now the next thing I wanted to ask you, have you seen a medical practitioner recently for any reasons at all?
I think I did a skin check maybe about 6 months ago.
Okay, great.
Yep.
All right, skin check 6 months ago. Awesome. Are you on any medications currently for any reasons at all?
I take magnesium just for because I work out sometimes and it helps with muscle joints.
Yeah, with the cramping and that kind of thing, certainly.
Yep.
Okay, so magnesium. Right. All right. Do you ever have any bouts of feeling dizzy or unwell or anything like that during or post-exercise?
No, not really. Only if I haven't had any water, but yeah,
Okay.
that's more like a
Very
dehydration.
important. Yeah, exactly right. I want to make sure we get that in. All right. Next thing I wanted to ask you about, do you have any family history at all of any illnesses, whether that be coronary, as in like heart-wise, or stroke, or diabetes, or anything along those lines?
No, not that I know of. I don't think so.
You're not aware of anything?
No, I'm not aware of anything.
Okay, great. Yeah, fantastic. And lastly, Sam, in regards to your physical activity, what activity do you do currently?
I generally do, I work out twice a week, so I have a trainer that helps me out with that, and it's usually just cardio and strength training as well. Yeah.
Okay, so basically you have a trainer, you work out a couple of times a week currently, and you're doing mostly cardio, but you do some resistance training,
Yep.
and you're doing that twice a week. For about how long for each session?
Generally 45 minutes to an hour.
45 minutes to an hour. Yeah, fantastic. So we basically put that down for yourself, Sam, as like moderate.
Yep.
Do you agree?
Yep.
That's about moderate. Awesome, fantastic. All right then. All right, so now, as we were saying, Sam, the next thing we want to go through and do is we're going to do your resting heart rate. So if I could ask you just to place your arm up on the table like this.
Yep.
Palm up. Great. And from here, we're just going to move this a little bit this way. Awesome. I'll then take these two fingers, place just here. And then what I'm doing is I'm going to count how many beats I get in 15 seconds, and then times that amount by 4 to give us what your resting heart rate is. All right, fantastic. Just write that in here. Good job. Okay. Okay, Sam, so as I said, the next thing we want to do is we want to go over and take your blood pressure. Have you had that done before?
Yes, I have a few times.
And what side do you normally have that done on?
Generally on this side.
On your left?
Yeah.
Okay, great. And as you're aware, this might be a little bit different to the one you've seen before. This is an automatic, okay? Sometimes you'll actually have it where it's an actual cuff. I think it's a stethoscope to actually do that particular measure.
Okay.
We're going to be using the automatic one today. Of course, as you're probably already aware of, it's going to go on the upper part of your arm here. I want to make sure you will feel a little bit of pressure when it actually pumps itself up. That's completely okay, as you would normally know. All right?
Yeah.
Does that sound good? You're good with that?
Yeah, definitely.
Awesome. Then what I'll have you do first for me is like we did with the heart rate. Have your hand on the table, placing it with your palm up, and then if you can roll your sleeve up for me, please.
Sure.
That'd be awesome. Thank you.
Just like this?
That's fantastic. Thank you. You just place your arm, palm up. Yeah. And just relax. Don't just relax as much as you can. All right. You just slide your arm in there for me. That's it. Very good. Does that feel okay?
Yep.
Fabulous. Again, just staying nice and relaxed. Right. And you feel a little bit of pressure as this pumps up. As you can see, it's doing its own thing. This will be a few moments. That's the thing about these automated ones. Makes it a lot easier.
It's very cool.
Okay, fantastic. So it's come up at 124 over 67, and your resting's about 68. So you've really come in a good range.
Great.
It's really quite good, okay? This kind of thing we'd expect to see a little bit of a change because you're probably a little bit anxious. Everyone is normally when they have these kinds of tests done, but given that, great job. Well done for you.
Thank you.
Great, Sam. So as we've been through the measurements already, we've done your old health screening, okay? We've been through your resting heart rate and blood pressure. And as I stated next, we're going to look at just taking your weight.
Great.
So in a moment, I'm going to get you to step up here on the scales. Make sure your weight's even as you get on there. Okay. Now, have you got any idea of what your weight is?
I think maybe 65.
So 65.
Yeah.
All right, so we'll find out. So if you'd just like to take your shoes off for me, if you could.
Yep.
Awesome. If you step up on the scales, just make sure that weight's nice and even. Good job. We'll just wait for a few moments. Excellent, great. So we're looking at around about 68, right? Now just remember, Sam, that's completely normal as well, because we can weigh a little bit different to what we are in the evenings compared to what we are in the mornings, and whether or not we have evacuated, so we've been in the bathroom, how much water we've had, those other things can make a little bit of difference on that.
Okay.
Does that sound good?
Yep.
Okay, Sam, that's great. So we've taken your weight. We'll just get these scales out of the way.
Yep.
And the next thing we're going to do is take a couple of girth measurements. Okay? Now these are referred to as a waist to hip ratio. We need to get these two measurements to work out what area of your health you're actually in.
Okay.
So when we do that particular measurement, it'll come up with a different ratio, and that'll give us an indication of where your health is. Does that sound good?
Yep. Perfect.
Great. And again, the first one we're going to do, we look at doing it through the narrowest point, through the belly button for your waist. Okay, and then we're going to take a hip measurement. The hip measurement typically done from this bony bit here called the rototrochanter on the bone of your upper leg, around through this area here, which I'll do from the side. Are you okay with those?
Yep.
Next thing I wanted to ask you, do you feel comfortable with removing your shirt? Because when these are normally done to be the most accurate, they're done on the bare skin.
Okay, I'm a little bit uncomfortable with that, so if it's possible to just leave my shirt on for the process, if that's fine.
Certainly, yeah. Whatever's going to make you feel the most comfortable.
Okay.
So what I'm going to ask you to do first for me, Sam, if you could just put your arms out to the sides.
Sure.
Like this. Fantastic. Just come here. And if you'd just like to find where your belly button is for me, please.
Yep.
Great. You can remove your hand. As I can see, it's probably a little bit narrow here. Very good, excellent work. Now we're just going to take the hip measurement. Great, you can put your arms down for me, Sam. I'll just quickly calculate those in a moment, and then we'll get that reading we want. I can let you how it relates to your health.
Okay.
All good?
Yep.
Fantastic. I'll just quickly roll this up and get it out of the way. How do you feel so far with everything? Do you feel quite comfortable?
Yes, I am actually. Thank you.
Great, fantastic. Just go over here. Okay, Sam, so we've been through most of the measurements we need to do today. All right. So the first thing we did, of course, is we went through the adult pre-screening form. Right? And as you can see on here, from some of the measurements we've actually been through, first thing is we went through any of your background, family history. We looked at what your exercise level currently is, and I believe you were saying you currently see a trainer, you're doing a couple of times a week, and you're doing mostly cardio with some resistance. Is that correct? Still?
Yes, that's correct.
Fantastic. We've done your weight, so I've got an idea of how much you weigh. Okay. The next thing we've gone through and done, and we did a resting heart rate for you.
Yep.
And then we did your blood pressure, which I've calculated the actual results on here for you also. And then we went through and just did the waist to hip ratio. And then noted the details on the form. The next thing I wanted to ask you is, do you have any further questions or anything you're unsure of in regards to the test that we performed today?
I think that covered everything for me for now.
Yeah? Fantastic, great. Then thank you very much for coming in. It's been lovely meeting you.
Thank you.
And then hopefully what we'll do is we'll see you in a very short future after we've spoken to your trainer as well. And then we can just work together to help you get the most benefit out of your particular workout and your training to achieve your goals.
Great.
Fantastic. Thank you very much again.
Thank you.
Okay, everyone. So thank you for joining us for our video today on adult pre-screening and fitness appraisals, okay, for Certificate 3 in Fitness here at Entrepreneur Education. And we look forward to seeing you in the next one. Thanks again.